Hey everyone, Dr. Eric here from MedBetter Health, and the topic I'm going to talk to you about is really important. How many of you are caregivers that take care of a person living with dementia? And how many of you have your loved one go to the hospital and things drastically change after hospitalization? What I'm going to tell you today is going to be super important and sometimes the difference between life and death. Are you ready? Come on with me. So, why dementia care gets harder after a hospital stay. Doctor, this is very often where folks tell me, Doctor, my loved one went into the hospital and when they came home, everything was different. They are refusing care, they aren't sleeping, they weren't like this before. So, let's unpack this together. The expectation very often is that we're coming into the hospital, there's a problem, the problem is fixed, and now things are going to go back to how they used to be. This is not the reality. Very often the reality for a person living with dementia and their caregiver looks like this, right? The hospital fixed the immediate illness. However, the transition home introduces a high-risk period of what? What's the high-risk period? Weakness, medication changes, which we'll talk about, and delirium. So, discharge does not mean back to baseline right away. Now, sometimes it does, but many times it doesn't. So let's figure out why. What happens in the hospital? Your person is 85 years old. They have dementia, right? Now, all of a sudden, they have what? Unfamiliar staff that are coming in and out. There's alarms going bim, boom, right? Different types of sounds, different type of lights. There's no regular routine. There's an unfamiliar place. On top of that, some people going into the hospital are going for surgical procedures. So there's IVs, there's recoveries, there's anesthesia. Think about all of this sensory overload on a person living with dementia. On top of that, I remember when I was a resident physician, right, New York Methodist Hospital, and it will be 3 o'clock and we need to do something called an ABG, an arterial blood gas. And you know what I mean? You got to do what you got to do. You're coming in, but it's 3 a.m. in the morning and the person is sleeping and you have to stick a needle inside their arm, right, inside their artery, not vein, a very painful procedure at 3 a.m. What do you think happens? Sleep disruption. Oh, the blood pressure wasn't controlled. Let's come in at 6 a.m. or 4 a.m. and take their blood pressure. Let's take blood pressure every 4 hours. What happens? Vital checks. Noise. Roommates. You have a roommate, right, that's making noise, that's in pain, that's screaming, that's yelling. And the person living with dementia can't get a period of just normal sleep. All these things affect the mental status of the person living with dementia. And this is a big one, a huge one. Immobility, right? Someone has a pneumonia, someone has a fall, they're laying in bed, they're not getting up. That is very dangerous. In fact, I always tell everybody, and here's a clinical pearl for you. Mom and dad's in the hospital for pneumonia, they're laying in bed, you think it's okay, they're getting treatment. Your question should be, all right, how soon is it safe to get them out of bed and into the chair? Out of bed, into the chair, out of the chair and walking with physical therapy. The sooner they're able to and the sooner you start to do that, the sooner you're bringing them back to baseline, because the longer the person living with dementia is laying in bed and not moving and not having any mobility, the more muscle weakness they're going to develop and the harder it takes to bring them back to their baseline. So some important things, and of course last but certainly not least are medication changes, right? New prescriptions that they never had. Polypharmacy. What does polypharmacy mean? Too many medications, right, in one bucket, and that bucket is where? Going into mom and dad's stomach, into their bloodstream. Sudden stops of medication they used to take before, right? You went into the hospital, things were chaotic, you forgot the list of meds that mom was taking. The hospital has an old list of meds that mom used to be taking, and now there's a sudden stop, for example, of something called Xanax. Huge thing. You're not allowed to abruptly stop. Now, obviously, your mom or dad, if they're older or they have dementia, Xanax should really be evaluated by your doctor, but that's a different story. Okay, medically stable versus functionally stable. Two different things. Mom could have a UTI with antibiotics and everything was treated medically, no more infection. But functionally now, there's a change, right? So above the surface, they're cleared for discharge. The hospital focus, rightfully so, is to stabilize the vitals, to treat the infection, to heal the wound, etc. However, underneath the surface, below the surface, there's the caregiver's burden, the home reality, weaker mobility, increased anxiety, new incontinence, medication side effects, fragmented sleep, and loss of daily routine. That's why, if you're a caregiver listening, very important before you leave the hospital that you sit down and you say with the case manager, with the doctor, a couple of things. Number one, I got to figure out, okay, mom has a hospital bed here. Mom has certain things here. We don't have that at home. Is mom a safe discharge home? Do I have all these things when I come home? And that's a question you shouldn't feel shy asking. Do I have all the things I need when I come home so that I can have a smooth transition? Hold up a sec, doc. I know you started these 4 new medications. I'd like to sit down with you and to go through. Here's the list of meds mom came in on. Here's the list of meds mom is coming out on. Why are there these changes? Oh, you've added 3 new medications? What are the side effects? Are there interactions? Should I be expecting anything with these new meds and I should be on the lookout for? That is all gold. You need to make sure you have these conversations. I always say, you may feel uncomfortable. It may be a difficult conversation. You may feel that you are putting the doctor on the spot or the nurse on the spot. But what do I always teach you? It's better to have difficult conversations than to be in difficult situations. So don't forget that point. Now, moving on, the twin post-discharge vulnerabilities. Number one, we've talked about a little bit, but I want you to know this, very important. Medication risks. Hospitalization often scrambles regimens. Watch, keyword, underline this, closely. Watch closely for signs of sedation, dizziness, constipation, urinary retention, sudden confusion. And we've talked about this already, but make sure to reconcile all the new meds against the pre-hospital list of meds. Next, very important, mobility decline. As I mentioned before, but I'll repeat it again because it's super important, extended bed rest causes rapid functional loss. A patient who walked may need help transferring out. Anticipate that post-hospital you may have a higher fall risk, and therefore you may need certain equipment, certain home safety assessments and equipment to look out for that. All right, super important. Now, moving on. This is about you, the caregiver. The caregiver who literally goes above and beyond for their person living with dementia. And we know that 80% of all dementia care happens at home. So who's home? You, the caregiver, just like my mom and my dad who are 70 years old. And they're taking care of my grandmother who is 93 years old. How many of you guys, comment below, how many of you guys are caregivers that are taking care of their loved one right now in this very moment? How many of you recently, within this week, came out of the hospital? How many of you, after coming out of the hospital, don't know what to do? How many of you wish that there was someone you can talk to and not just wait for a week or two after you see your doctor after the hospital, but someone you can talk to who can actually explain this to you? Well, look, you don't have to wish no more. Thankfully, Medicare came out with a new incredible program. It's called the GUIDE model. It really stands for Guiding an Improved Dementia Experience. Who is this program designed for? It's designed for you. Who? You, the caregiver. Yep, you watching this video right now. And what does it offer you? Well, imagine having someone like me spend time with you on a monthly basis, go through all of these things, go through medications. Imagine at 11 p.m. when mom is acting a little off after the hospital and you don't know who to call, you have a helpline phone number that you can call and get help. Or, here's better, imagine if after the hospital you've got all these changes that I'm talking about and you are overwhelmed and a Medicare program would say, Samantha, don't worry about it. We're going to send someone to your home. They're going to be in your home for 4 to 5 days with you, with mom, to give you some relief, and we, Medicare, will pay for it. Well, you don't have to imagine that anymore, because here at MedBetter Health, we have been selected by Medicare to participate in this new incredible program. Now, if you're interested in this program, I want you to take a look up right here. There's going to be a link. You're also going to see a QR code, and also in the description below, there's going to be our website that you can go, sign up, and we'll reach out to you and help you get started. Now, before we close out for the day, there's 19.6 billion hours of unpaid caregiver time that's provided annually, and 18 to 28% of dementia patients are readmitted to the hospital, close to 30% within 30 days, right? You have to relive that deja vu over and over again. So if you feel overwhelmed after a discharge, you are not failing. It's not you. What's happening is you are just unsupported in a highly complex medical transition, and that's where the guide model comes in. Okay, now I want to give you, this is very important, I want to give you Dr. Eric's top 5 post-hospital questions to ask. You ready for this? Super important. Number 1, are they back to baseline? Are they thinking the way they used to think? Are they eating like they used to eat? Are they walking like they did before? That's number 1. Number 2, could this be delirium? If they're not, they're baseline. Could this be delirium? And if you're interested in learning about what is delirium, got an incredible video. If you click here and you're on YouTube, you can see our video where I go into the difference of dementia versus delirium. Next, super important. That's why it's the middle. It's the glue that holds everything together. What medications changed? What was started? What was stopped? What was adjusted? Right? What did we miss? What side effects with these new meds? Let me look it up. Let me speak to the doctor. And hey, what physical function was lost? Can they safely transfer and use the bathroom? Can they get up? Can they use their hand to feed themselves? Right? Super important question to ask. And last but certainly not least, as I always say, if you're in an airplane and there's turbulence and the masks are going to fall down, what does the flight attendant tell you when you have your child with you? The flight attendant says, ladies and gentlemen, we're going through some turbulence. The masks are going to fall down with the oxygen. Please first put the oxygen mask on who? On yourself, the caregiver, and then you put it on your child, because if you don't put it on yourself and you're not taking care of yourself, you won't be able to take care of your child. Same thing here, right? What support does the caregiver need? What equipment do you need? Who do you need to come home and give you home health, right, in the transition? That's what the guide model is all about. So I hope you enjoyed this video. I want you to do a couple of things. Obviously, you need to find out about this new program. The link again is right over here, QR code, and we also have the link in the description. Next thing, if you found value in this video, I want you to like. I want you to subscribe. And most importantly, what do? We do well when we give to others. I want you, it doesn't cost you anything. I want you to share this video. If you're on LinkedIn, if you're on TikTok, Wherever you're at, I want you to click the share button so other caregivers like you can get the value of this video. My name is Dr. Eric from MedBetter Health, and I'll see you on the next video.